Okay, this is Final Project Deliverable by Hannah Langenfelter. First of all, the background information. Patient care deems to be the #1 priority in the New Century Health Clinic as preventative medicines are prescribed and traditional care methods are utilized. However, due to the fact New Century Health Clinic lacks the necessary personnel to exercise perfect performance, a preliminary investigation took place on March 10, 2014 with the permission of Dr. Jones. New Century Health Clinic faces a problem of a constantly growing workload. A solution must be quickly assessed due to the fact the current staff are not fully equipped to handle the current workload. Because hiring more personnel would not be as efficient as implementing a new system, a systems analyst was hired to properly assess the problem and identify a solution. Further along the system's request, New Century Health Clinic possesses one main problem in the system they currently use. Many personnel are having a difficult time keeping track of patient appointments, invoices, payments, and insurance claim processing. In order to increase patient satisfaction and process the necessary information smoothly, necessary action must take place. The new system which shall be implemented will need to be developed in-house or purchased from an outsourcing firm, software vendor, or cloud services vendor. The benefits of the new system, as opposed to hiring new workers, the benefits of computerizing New Century's office systems are greater. A computerized system will keep track of patients' appointments, charges, insurance claim processing, and reduce paperwork thereby, increasing productivity, reducing overall operational costs, improving accuracy by reducing input and processing errors within health records, improving quality and convenience of patient care, providing advanced e-prescribing, providing unlimited space for recording information, allowing fast care and decision-making response from assigned medical professionals, improving diagnosis and treatment, and ultimately increasing the number of patients served daily. A reduction in the amount of manual labor will eliminate unnecessary expenses and improve employee morale by eliminating stress. The recommended solution: after hiring a systems analyst, the analyst assessed whether it would have been best to develop a new system in-house or purchase the software from an outsourcing firm, software vendor, or cloud services vendor. The in-house solution deemed to be the best solution due to the low implementation costs, higher ROI, and sufficient break-even point. After careful consideration and analyzation, the in-house solution would also present benefits that the solutions would not. When developing an in-house solution, one must consider that the clinic would know what actions are necessary and what is needed. By knowing the better necessities to implement, the in-house development has a cutting edge. Systems requirements, outputs. These are a few of the outputs. The new system should send a daily reminder to Lisa's son containing a list of people to call with scheduled appointments for the following day. Services rendered to patients will be updated daily in the system. A monthly statement will be constructed by the software if services were provided that month for a patient in the household. Payments were received that month from any member of the household, and payments were received that month from the household's insurance company, or the household has a positive current balance. The software will send a daily list to the providers consisting of patient appointments and procedures most likely occurring. As far as inputs are concerned, the new computer system needs to store records of service charges with specific codes composed by the providers of New Century Health Clinic instead of paper filing patients' records. The records should be recorded within a computer system. Included in the patient's file, the new system will not only keep track of services rendered, but also will keep track of each patient's insurance. The new system will also keep track of which patients belong in certain households. As far as processes go, these processes will be outlined further in the level 0 diagram and the context diagram, but a few of them are: the new system must be able to assign dollar amounts to services rendered by providers through specific codes. Files should be separated by alphabetical order by the household's head name, household charge payment record, and patient file. The double entry accounting system will become computerized. A weekly report should be generated watching providers with services rendered. Performance requirements. The new system should be able to maintain and store a significant amount of patient information without crashing. The purpose of the new system is to make actions performed by staff less time-consuming. The new system should run quickly and be updated at least once a month when software updates are made available. The system should operate at a maximum of 5 seconds for response time. The system should run Monday through Saturday all year. So as far as a few security controls, because patient records are provided by HIPAA, the new system should have a series of firewalls. Before entering the system, a series of passwords should be entered. ID badges should be utilized, and if the computer system remains inactive for more than a few minutes, the computer should automatically log out and require password entry once again. Alternative solution, the first solution, which is in-house. These are a few of the background information that a lot of us are familiar with in the book. I'm not going to take the time to review them because we all of the class should know what the dollar amounts are. But it just discusses the systems analysts, what they charge per hour. The crew members will need to be trained 10 hours each week for the first 3 months. A total of $3,600 would be charged to New Century Health Clinic, including training costs. The maintenance cost per year will total $2,080. The initial hardware and network installation costs will total $5,000. This is going to be accrued within the first year, and the total costs in year 1 are $17,180. For the vendor package, this is also listed in the book. Within the third year, the clinic will finish paying off the vendor package by submitting the last payment of $3,000. So they're going to make $3,000 payments per year for 3 years. The new package will take a total of 4 weeks to install. The system analyst will charge $3,500 to install the software. Technical support from the vendor will be free for the first year. However, technical support will cost $500 per year. The total charges for the first year are going to total somewhat less than the in-house solution. Alternative solution, there's Clear Data. This is one of the outsourcing firms that were utilized. It's a cloud computing company that we researched. Alternative solution, another one is Accenture Outsourcing Services. It's another outsourcing provider that provides IT technology executives with the experience and guidance that can provide mechanized distribution and intelligent insight along with the flexibility to accommodate changing organizational goals. And lastly, we have Halogen Healthcare. This is another software vendor that we research outside of class. And as far as the cost-benefit analysis is concerned, these are a few data. This was in-house solution. It totaled about, in the first year, which we discussed earlier, was $17,180. The cumulative benefits, however, were $64,100, and the ROI deemed to be 60%, 22. A vendor package solution, the ROI was 32.62%. And then the rest of the data we analyzed on our own and made up some of the numbers, but pretty much the ROI for the Clear Data was 28.03%, and Accenture Outsourcing Services with 13.31%. And the Halogen Healthcare was 15.91% ROI. And for the unweighted tables, this is some of the unweighted tables. I analyzed for the unweighted evaluation model were cost, completion data, ROI, break-even point, and the total points, the one that won in this case was the in-house, but after doing the weighted table, the in-house also won once again. And the recommendation, the in-house solution remains to be the best solution due to low implementation costs, high ROI, and sufficient break-even point. For the level 0 diagram, this is what I came up with. It really focuses on services rendered weekly report, dollar amounts to process codes, reserved appointments, and specific codes to services rendered. And then we have patient records, providers, patients, security, and insurance claim forms as far as the entities we're concerning. And this would be the context diagram that we're going to discuss. This is with the new implementation system. That's the main thing we're focusing on. Focusing on patients, providers, secretary, patient records, and insurance claim forms. And then we have the report design. The report design was based on the employee hours, the overtime hours, and total hours. These were actually, some of these were listed in the book. And then we also have an entity relationship diagram. This diagram was actually pretty complex. It really outlined New Century Health Clinic patient records, patients, appointments, secretary, providers, medications, insurance claim forms, accounting department, and software. And then we have the input form design. I did a design based on what the healthcare would ask, the questions they would ask upon a patient coming into the office. And some of the questions would be, please check the box of your insurance provider, and please check the boxes of any symptoms you're currently experiencing. As far as the tentative project is considered, we have, this is the implementation plan. It's going to take up 84 days. That's what it said in the book. And I'm doing it March 11th through the 9th of July. System architecture is designed. A series of up-to-date computers must be purchased and assembled. The LAN must join between network clients, implement mesh network, install router and client-server-based processing. The system's changeover approach, no benefits were existing within the old system, I deemed to be. So we're going to implement the direct changeover approach, which is relatively cheap, needs to be tested properly, and the best approach when implementing commercial software. As far as training recommendations are concerned, they're going to be 10 hours each week for the first 3 months. Being that training current staff members is crucial to the success of implementing the new system, analysts must keep this in mind when designing the in-house solution. Training the staff will take approximately 10 hours each week for the first 3 months. Microsoft PowerPoint presentation software will be utilized upon every training session for the purpose of visualizing what the program will look like. For instance, the secretary would not be performing the same function as a provider when entering and storing data in the new system. Proper documentation must be constructed for the purpose of ensuring easy interaction between the new system and staff members. Bug tracking software will be installed for the purpose of tracking program defects, code changes, and patches. System and documentation, including data dictionary entries, data flow diagrams, object models, and screen layouts, must be recorded with no errors. Systems maintenance and security recommendations. These are a few. These are pretty much listed in the book in detail, and I put them in my own words, so there really isn't too much to them. To make the system easy to use for staff members, adaptive maintenance will be applied. Perfective maintenance will help make this new system more efficient, maintainable, and reliable. Where the new system is likely to run in trouble, preventative maintenance is applied. And that's it.